town in tow with his brother, his younger brother, Matthew Bush. We've been lucky enough to have these two guys in the community for the last 5 years. Jeff Bush's specialty is adult reconstructive surgery. You may know that as total joint replacement surgery. He does a lot of hip and knee replacements. But his background is he grew up in Pennsylvania, went to Bucknell University, got his master's in mechanical engineering, or biomechanical engineering. So he has that background as well. He went to medical school in Philadelphia and then did a fellowship for adult reconstructive surgery at Duke University. So, Jeff,
Thank you. Thanks for having me. Thanks very much for having me here. Thanks for the meal, first of all, that was great. I apologize that I don't speak French. My mother was actually a French teacher. She's a wonderful woman. She taught me many things, but she did not teach me how to speak French. So we'll give it a go in English. And, you know, like Jeff said, I basically do, you know, we do some other things too, obviously, but a lot of hip and knee replacement has sort of been the specialty that I've focused on, and I've been lucky enough to do that. And I love it. I do actually consider myself very fortunate that what I get to do for a living is replace hips and knees. I have a bit of an engineering background, and with the combining some of that stuff with the medicine has been a great fit for me. And I could talk about it all day, and I promise that I won't. I think they told me about 20 people have arthritis. We all have a little bit of it here and there at some point. But if there are any questions, you know, raise your hand, interrupt me, or you can wait till the end, or you can grab me later. But definitely, you know, one of the reasons you're here probably is you have a question or two that you'd like answered. So don't leave without making sure I answer them. So we're going to talk a little bit about, you know, what causes joint pain. Usually, in my case, the folks I see, hip and knee pain. What are the treatment options, and then what is joint replacement? What leads someone down the path of having their hip or knee replaced, and what should you expect when you've had that done? More than, you know, probably even more than this, but more than 300,000 knees and 300,000 hips are replaced every year in the country. Some weeks I feel like we're doing most of those, but we certainly do our share, and are lucky enough to have a pretty good experience with it. But that number tends to rise every year. They think that over the next 20 years or so, the number of total joints done in the country is actually going to double. So if your knee hurts, you're certainly not alone. There are millions of you. As far as what causes it, the most common, you know, thing is arthritis. And what I see mostly in the office is people with osteoarthritis, sort of the traditional standard wear and tear on our joints. Other things that cause it, I'm sure some of you either have or know people with rheumatoid arthritis, which is just sort of the same end result, but a different form of joint wear. Rheumatoid arthritis is more of an inflammatory process where the joint will wear out because the lining of the joint gets so inflamed that it sort of eats away at the cartilage. And that's a very painful and debilitating thing. We see a lot of people, especially working in a trauma center, that develop arthritis because of being in a bad accident or having a fracture around their hip or their knee. And we can get the bones to heal, but sometimes the injury itself causes arthritis. And avascular necrosis, also listed there, is sort of another rare form of arthritis where the blood supply to a joint fails, and that can cause some pretty painful arthritis. And the pain, you know, you can have good days and bad. It can be constant, or it can sort of come and go. And what we tend to see is when people start having more bad days than good is when they kind of knock on our door and we talk about maybe what we can do with their hips or knees. Some of you, of course, are blessed with having it all over your body, and others may just come in with only a sore hip or a sore knee. More than 6 or 7 million visits to the doctor every year are just from osteoarthritis alone, and millions of adults obviously are complaining of some type of joint pain. Like I said, the most common we see is osteoarthritis, and this is just a sort of an artist drawing of it. This is a normal looking hip here, and the ball and socket, this is a hip joint. Normally if you look at it, it's just nice and smooth. It looks almost like a cue ball. It's just perfectly round and smooth and shiny. But if you look at one that's starting to wear out, on the other side, you can see where the joint edges are all destroyed, the cartilage is gone, and you can't tell where the ball stops and the socket starts. And that's an arthritic hip, and that's what we see a lot of. And there are other causes to it. There's certainly a genetic link. Almost everyone who's got bad hips and knees has a mom or dad with the same. It's not the type of thing where they've identified, it's on this gene or that, but there's certainly a pretty strong family link. A lot of wear and tear. We take care of a lot of people that have just been working their whole life. They're on their feet all the time, or they've had a bunch of hip injuries or knee injuries, and that type of thing will certainly lead to it. And like I said before, it causes so many hospital visits a year, and certainly a lot of visits to our office. One of the things, this stat here that I thought was interesting, that the pain from arthritis can be so bad, that the second line here, that people with arthritis, about 40% of people with knee arthritis felt that it affected their overall health. They actually, even if that was their only problem, they said that their health was either poor or fair because that was enough of an issue that it was really slowing them down and limiting the rest of their life. Rheumatoid arthritis, I'll just mention briefly because a lot of people have it. We certainly see a lot of it. It's unfortunately typically women, but it's very common. It affects all the joints. It's kind of known for the deformity it causes in people's hands, but it can certainly cause a lot of pain and deformity and arthritis type symptoms in the hips and knees. And this is just sort of another artist's picture of the lining of this joint sort of attacking the underlying cartilage, which at one point was healthy, but it just wears it away until it's gone, and it's quite painful. It's just sort of a normal hip on the right and a bad rheumatoid arthritis type hip on the left. And even if you don't spend all your time looking at x-rays like I do, you can look at that right away and know that we have a problem there that's going to be pretty painful. And then post-traumatic arthritis is relatively self-explanatory, but we certainly see a lot of people that have banged themselves up in one way or another in a car accident or a motorcycle wreck, and a lot of those folks are going on to have hip and knee surgery as well. Avascular necrosis is just a different type of arthritis where like I said, the blood supply to the joint fades away, and that just causes the ball and socket in the hip to really just sort of fade away until it's not there anymore and there's not much of a joint left. So I'll show you some pictures and then just some of the kind of things we do in surgery. But a normal healthy knee looks sort of like this. This is the normal knee joint. There's some good healthy cartilage on either end. It's balanced, it's aligned nice and straight. This is the kneecap. And when it starts to wear out, these parts of the joint where we're bearing our weight, when you walk, the part of the joint that's just taking the brunt of that force is what starts to wear out first. And they start to get a little area of arthritis there, and with time it just kind of tends to get worse and worse. So this is sort of a healthy knee here on the left, and you can see that the cartilage doesn't show up on x-ray, so it looks like a really nice even space across there. And on the right, this is someone who has lost all that cartilage, and they have the bone-on-bone arthritis you sometimes hear people talk about. So that's what we see a great deal of. What we do with it, even though I'm a surgeon and I love nothing more than replacing hips and knees, our goal is usually to try to find a way not to do it, and try to find a way to help you, get along.